Arsenic trioxide is used in combination with tretinoin to treat acute promyelocytic leukemia, a type of cancer in which there are too many immature blood cells in the blood and bone marrow. In certain people as a first treatment. It is also used to treat APL in certain people who have not been helped by other types of chemotherapy, or whose condition has improved but then worsened following treatment with retinoid and other types of chemotherapy treatments. Arsenic trioxide is in a class of medications called antineoplastics, which works by slowing or stopping the growth of cancer cells. How to use? Arsenic trioxide must be administered under the supervision of a physician who is experienced in the management of acute leukemias, newly diagnosed low to intermediate risk acute promyelocytic leukemia. Induction treatment schedule. Arsenic trioxide must be administered intravenously at a dose of 0.15 mg per kilogram per day, given daily until complete remission is achieved. If complete remission has not occurred by the day 60, dosing must be discontinued. Consolidation schedule. Arsenic trioxide must be administered intravenously at a dose of 0.15 mg per kilogram per day, 5 days per week. Treatment should be continued for 4 weeks on and 4 weeks off for a total of 4 cycles. Relapsed refractory acute promyelocytic leukemia. Induction treatment schedule. Arsenic trioxide must be administered intravenously at a fixed dose of 0.15 mg per kilogram per day, given daily until complete remission is achieved. Less than 5% blood present in circular bone marrow with no evidence of leukemic cells. If complete remission has not occurred by the day 50, dosing must be discontinued. Consolidation schedule. Consolidation treatment must begin 3 to 4 weeks after completion of induction therapy. Arsenic trioxide is to be administered intravenously at a dose of 0.15 mg per kilogram per day for 25 doses, given 5 days per week, followed by 2 days interruption repeated for 5 weeks. Dose delay modification and reinitiation. Treatment with arsenic trioxide must be temporarily interrupted before the scheduled end of therapy at any time. That a toxicity grade 3 or greater on the Natural Cancer Institute common toxicity criteria is observed and up to the possibility related to arsenic trioxide treatment. Patients who experience such reactions that are considered arsenic trioxide related must receive treatment only after resolution of the toxic event or after recovery to baseline status of the abnormalities that prompted the interruption. In such cases, treatment must resume at 50% of the preceding daily dose. If the toxic event does not recur within 7 days of restarting treatment at the reduced dose, the daily dose can be escalated back to 100% of the original dose. Patients who experience a recurrence of toxicity must be removed from treatment. Contraindications. Arsenic trioxide is contraindicated in patients with hypersensitivity. Precautions. Before using this medication, tell doctor or pharmacist if you are allergic to arsenic or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist your medical history, especially of kidney disease, diabetes. Arsenic trioxide may cause a condition that affects the heart rhythm. Quad prolongation can rarely cause serious, rarely fatal, fast irregular heartbeat and other symptoms such as severe dizziness, fainting, that need medical attention right away. Side effects. Pain, redness, swelling at the ejection site, nausea, vomiting, diarrhea, stomach abdominal pain, tiredness, cough, headache or dizziness may occur. If any of these effects persist or worsen, tell doctor or pharmacist promptly. Both leukemia and this medication can lower the body's ability to fight an infection. Tell a doctor promptly if you develop any signs of an infection, such as unexplained fever, chills, or persistent sore throat. Tell a doctor right away if you have any serious side effects, including easy bleeding, bruising, nosebleed, increased thirst, signs of kidney problems, such as change in the amount of urine, bone, joint pain, decreased appetite, unusual weight loss, muscle pain, stiffness, spasm, numbness, tingling, swollen hands, legs, feet. Symptoms of liver disease such as nausea, vomiting that does not stop, severe stomach, abdominal pain, yellow in eyes, skin, dark urine. Get medical help right away if you have any very serious side effects, including chest pain, severe dizziness, fainting, fast irregular heartbeat, coughing or blood, mental mood changes such as confusion, muscle weakness, bloody, black, tarry stools, vomit that looks like coffee grounds.